If you wait until after a fall to ask for a mobility assessment, you probably are waiting too long. Today I want to talk about when it's time to ask for a mobility assessment and why doing it sooner rather than later can protect independence, confidence, and safety. I've worked with older adults and families for many years as a senior home safety specialist, and I can tell you this: the signs are often there long before a serious accident happens. Most people think you only need a mobility assessment after something goes wrong, such as after a fall or a hospital stay or after a scary moment. But I want you to think differently. A mobility assessment is not just about reacting, it's about preventing. So when should you ask for one? First, if you notice changes in walking. If someone starts shuffling their feet, walking slower than usual, holding on to walls and furniture, or avoiding stairs, those are early warning signs. The person may not complain, they might even say, "I'm fine," but your eyes tell you something has changed. Second, if there has been even one fall, even if it seemed minor, even if they say, "I just tripped." Falls are rarely random. There's usually a reason. It could be balance, it could be weakness, could be vision, could be medication side effects. A mobility assessment helps to uncover the cause instead of just making guesses. The third time you want one is after any hospital stay. Hospital stays can reduce strength very quickly. Even a few days in bed can lead to muscle loss. I've seen strong, independent seniors come home weaker than they realize. A mobility assessment can help rebuild safely before another problem happens. Fourth, if you notice a fear of falling. This one is big. Sometimes the body's not the biggest problem, the fear is. When someone starts avoiding activities they used to enjoy because they feel unsteady, that fear can lead to less movement. Less movement leads to weaker muscles, and weaker muscles increase fall risk, and it becomes a cycle. Breaking that cycle early really matters. Fifth, if there's a new medical diagnosis. Conditions like Parkinson's disease, stroke, arthritis, neuropathy, or dementia can affect mobility. Even vision changes can impact balance, and hearing changes can as well. I know this personally because I have otosclerosis, and before I had my hearing surgery and had my hearing fixed, I had a harder time with balance. So when there is a new diagnosis, it's wise to ask for an assessment right away. It sets a safe baseline and it gives you a plan. Now, let me explain what a mobility assessment actually is. It's usually done by a physical therapist or an occupational therapist. Sometimes a nurse practitioner or geriatric specialist may also be involved. They look at strength, balance, walking pattern, endurance, and safety awareness. They may watch the person walk. They may test how quickly the person can stand from a chair. They may check how steady the person is when they're turning. They probably will also evaluate how the person moves in the home, especially around stairs, bathrooms, and tight spaces. A mobility is not painful and it is not invasive. It's simply a structured way to understand how safely someone is moving around in their space. And here's the important part. The goal of this is not to take away independence. The goal is to protect it. Many families worry that if they ask for an assessment, it means that they're admitting weakness. But I see it differently. I see it as a strength because you're being proactive. Let me share something I see often. An older adult starts walking slower, they're holding on to furniture. The family notices, but they don't want to upset the person, so no one says anything. Then one day there's a fall. Now we're reacting. Now there may be an injury. Now the person's confidence is shaken. It is so much easier to prevent a fall than to recover from one. A mobility assessment might lead to simple recommendations. They could be something like a few balance exercises you do every day, or maybe a physical therapy program for a couple weeks. Maybe it's something like adjusting medications or installing grab bars or better lighting. Maybe it could include recommending a cane or a walker, But that isn't a sign of weakness, it's a tool for freedom. I always tell families assistive devices are not about giving up, they are about staying active longer. And here's something else to consider. Mobility is connected to everything. If someone feels unsteady, now they may start avoiding showers because they're worried about slipping. They may stop going outside. They may stop attending social events. Over time, their isolation increases, their mood can decline, and as a result, physical health can decline. Mobility affects physical health, emotional health, and social health. So when should you ask for a mobility assessment? Ask when you notice change. Ask after a fall. Ask after a hospital stay. Ask for one after there's fear or a new diagnosis or when your gut tells you something is not quite right. You do not need permission to be proactive. Start by talking to the primary care doctor. Ask for a referral to physical therapy. Some home health agencies will even offer in-home assessments, and many outpatient clinics specialize in balance and fall prevention. If transportation's difficult, ask about in-home services. There are options. And if you're an older adult listening to this yourself, I want to say something directly to you. Needing a mobility assessment does not mean you are failing. It actually means that you are very smart. It means that you want to stay independent and you care about your future, and that is something to be very proud of. The earlier you address mobility changes, the more choices you keep. Waiting often limits choices, so pay attention to small changes. Small changes are those little whispers. Falls are screams. Listen to the whispers. So thanks for joining me today. Please share this episode with someone you care about who could use the information to make their life safer. You'll find more resources for seniors and caregivers on our website at seniorsafetyadvice.com. And if you're searching for an Aging in Place specialist, please visit our sister website at aginginplacedirectory.com. And if you haven't subscribed to our YouTube channel or to this podcast yet, go ahead and do that right now. Then come back tomorrow for another daily moment of guidance and encouragement right here on the Senior Safety Advice Podcast. Until next time, thanks so much for listening. Take care. Bye.